now we will be doing hip external rotation against gravity. So you'll have your client seated with their feet not touching the ground and a towel under their leg. You'll be stabilizing the distal end of the lateral femur, palpating the gemelli and obturators. So I'm going to feel your bottom. Is that okay? Can you move your foot inwards? I'm sorry. Can you move it towards that wall? Perfect. And now I will be resisting at the distal end of the tibia. Good. And now for a gravity lesson, I'm going to ask my client to lay on their back. And you're going to need to have your legs extended on the table. Okay? And stabilizing at the iliac crest, feeling for the gemelli and obturator still. Can you bring your foot out? Bring it back in and just bring your foot out. Perfect. Awesome. Okay, and now for hip internal rotation, I'm going to ask my client to be seated again with the feet not touching the ground and a towel under the leg. Okay, and you'll be stabilizing the medial part of the femur and feeling for the gluteus medius. Okay, I'm going to touch your bottom. Is that okay? Okay, and now can you bring your foot out towards the outer wall? Yes. Good. And now do it again. And you'll be resisting at the tibia. Perfect. And now for gravity lesson, you'll ask your client to lay back on their back with your legs extended. Stabilizing at the iliac crest, feeling for the gluteus medius, and asking them to rotate their foot inwards. Awesome. Okay, next is knee flexion, and you'll start with your client laying on their belly or in prone. Can you please lay on your stomach? You'll be stabilizing the posterior thigh and palpating the biceps femoris. Okay, can you please bend your knee like that. Okay, and do that one more time. Awesome. And now you'll be resisting at the distal end of the tibia. Okay, good. And for gravity lesson knee flexion, you'll be asking your client to lay sideline. The therapist will be holding the upper leg of the client, stabilizing the posterior thigh, and asking them to flex their knee backwards. So can you please, with your bottom leg, can you please kick your bottom? And it would probably be wiser for the therapist to have their back towards the client. One more time. Okay. For knee extension, the client will start seated. And I'll be stabilizing the mid-thigh and feeling for the rectus femoris. Okay? Can you bring your foot up towards the ceiling? Good. And now I'll be resisting at the distal end of the leg, but ask your client to unlock their knee first. Good. And now for knee extension gravity lesson, you'll ask your client to lay on their side on the mat. Okay. And can you start with your knee flexed? Your bottom knee flexed. And now can you extend your bottom knee? Perfect.